welcome to Health Curious Episode 6. Today, I'm speaking with Miss Danna from Baltimore, Maryland. All right, so let's start with a little introduction. Tell me a little bit about yourself.
My name is Danna, and I am 52 years old. I have a 13-year-old daughter, and I currently work as an electrician.
What has your experience been like dealing with doctor's appointments, hospital trips, healthcare-related issues in general, etc.?
Interestingly, quite recently, I've actually been in the hospital twice, or to the ER, I should say twice. And I had two vastly different experiences at two different hospitals. The first, I went to the ER and actually broke my arm and elbow. So two broken spots. The hospital did not pick up on it.
Oh, wow.
Despite x-rays and things like that. They also were not great about taking my insurance, which supposedly they were, but there were so many different bills from different, so they're all covered, I guess, under the umbrella of the hospital, but some of them are out of network. And so I had to foot the bill for all of that, despite having a misdiagnosis that wasn't caught until I went to an orthopedic specialist.
Oh, wow.
So that was not the greatest experience, and it left me really frustrated. Difficult to get information about the billing, why it was not covered, and things like that. That was quite frustrating. My second visit was recently, earlier this year. I had spent the night over a friend of mine and his wife. She rescues cats, and I had spent the night over there, and they're all in one room, but there were a lot of cats there at the time. And I woke up and I had difficulty breathing. By the time I got home, I'd been home about 3 to 4 hours and I could not catch my breath. So I actually went to a urgent care clinic first, and they sent me to the hospital. That hospital was much more organized, and possibly it's because my injury was more concerning, I suppose. But the hospital was better equipped, or better run, in my opinion. And I just got my bill, and I believe it covers everything. So I got one bill, and hopefully that will be that. As far as doctor's visits, my doctor, I've been with her for 20 years. I think one of the best things to happen is the telehealth visit, maybe since COVID, because if I'm sick, I don't actually have to go into the office. I can usually set up a telehealth appointment with her. Some of our check-in appointments between actual physical examinations can be check-ins via telehealth, and that's super convenient. And they get billed out the same way. So that's one of the things I've really caught a shine to.
When you mentioned the two different experiences with the hospitals, I'd have to imagine it's a little concerning, to say the least, to not know what type of care you're supposed to get, especially with health-related issues that really impact your way of life.
Mm-hmm.
Leading off of that, what a medical experience, good or bad, impacted you the most?
I guess the birth of my child, actually. I did not carry her. She has another mom. She has another mom. And so my wife carried her during the pregnancy, and during delivery, that there were some things that were happening with mom, and I feel like I didn't give the attention to my just born child that I should have, because I was worrying about her mom at the time. And everything was fine in the end, but it was pretty concerning at the time, and it was chaos. So that was quite a split experience between worrying about my wife and worrying about my kid. And I regret that to this day, that I didn't take my child into my arms immediately and things like that. But it was that's probably the most lasting and intense experience I've ever had medically, despite the things that have happened to me.
How has this experience impacted you as you've lived your life since then?
I think it's just something that sort of stays with me, that feeling that the anxiety that was in place at that time, if that makes sense. I think back to the birth of my daughter, and it certainly was a very happy experience, but it wasn't until after that it was happy. It was terrifying, and something that should have been just out of the gate great. Wasn't. And I think that in some ways, I guess if it still affects me in any way, it affects the memory. I mean, when I think of the memory of the birth of my child, it's not just joy. And so there's a bit of regret, I guess, for lack of a better term, because I didn't do anything wrong. No one did anything wrong. It's just that it wasn't 100% joy. And that, I guess, so psychologically speaking, that is more of an impact than actually the medical procedure itself, if that makes sense.
You can answer this very generally, but do you think there's anything the hospital or the hospital staff could have done better to make this experience less stressful?
I don't think so.
Aside from that, what do you think are areas of growth that should be implemented with hospitals to make the experience of going in for even just a routine checkup better?
I think the most critical issue right now is staffing. And I think it's full capacity. I think that then people that at work are happier. They're more able to be present for patients. They're more focused. I think if you're taxed out working, covering shifts, things like that, I think it makes it more difficult to do your job as well. So I think a lot of because I would say that 90% of making patients experience positive is patient care and concern. And I think, I do think that most people get into healthcare for that. And so I think if you're only going to be able to be as helpful as you are healthy. And so if your staffing needs are covered, I think that's the very first start. There's so many other things out there that I can see might impact things, money, pay, things like that. But full staffing, I think would be a really good place to start.
You mentioned before that you've had your doctor for what was it, 20 years now?
Yeah. Yeah.
Um,
She's a PA, but yes.
what criteria went into choosing her?
I got a referral from my boss at the time who had seen her for several years and liked her. So that was it. She took my insurance, that kind of, I mean, it was 20 years ago. I didn't really think of, I mean, as I get older and as she gets older, actually, I will be needing to find another doctor. I think there will be more than just, I'll actually do some investigation instead of just saying to someone, hey, who's your doctor and do you like them, kind of thing.
Do you think if they accepted your medical insurance or how fast they can get to you, do you think those factor into if you were to get a new doctor in the near future, do you think that would impact the way you research and investigate?
Absolutely. I mean, unfortunately, them taking my medical insurance is to be a priority. I can't afford out of pocket. And I do think that a rapid response time or, maybe some flexibility in terms of visits. Do I have to go in every time before, if I'm just sick or if I pull a muscle or something, and I realize that takes time to build that sort of rapport, but I think speed of service or availability is pretty critical.
What advice would you give to others who have experienced maybe the same thing you did when you went to those two hospitals and the difference in care?
Well, I do wish, even at this point, that I had taken a stronger approach to the hospital where the misdiagnosis happened. Part of me almost felt as though I shouldn't have had to pay that bill. So I think I would have fought harder for my own rights at that time or had some redress in terms of just the continual billing and might have just raised the issue that it was a complete misdiagnosis and saw if that had any effects because so much of that was out of network, despite the hospital being in network, that it just made it difficult. It was a lot of money. And so I think I may have tried to do differently with that. And I think, I had such a different experience at the other hospital. I actually turned in positive evaluations of the staff and things like that, because I think it's important when a good job is being done for them to know it.
That segment was my interview with Miss Danna. I found it truly touching to listen to her open up about experiencing the birth of her daughter and what that meant for her future. I also found that this interview drew upon important takeaways, especially through her comparison of the two hospitals she went to and how the experiences you have at the hospital really come down to your quality of care. I would just like to thank Miss Danna so much for sharing her story. Thank you for listening to Health Curious. If you'd like to subscribe, you can do so on Spotify or YouTube. I hope you'll join me again soon.